Good afternoon, everyone, and welcome to the Brainy Boomer Lecture Series, Les Boomers Brillants. The Brainy Boomer Lecture Series, initiated in 2007 by the Education Committee of the McGill University Research Center for Studies in Aging, to support its objectives, raise awareness, and educate the community at large. The goal of this series was to suggest and initiate practical steps to improve brain health, to prevent other age-related disorders, as well as to promote healthy lifestyle choices amongst the most populous generation in history. Thank you for joining us today. And now, Mary, if you'd like to present our students today.
We have a group of nursing students that will be presenting today. There are 6 of them, and I will let them introduce themselves. Go ahead.
Good morning, everyone. Welcome to our workshop, Moving with Confidence, Living Well with Arthritis. We are very happy you are here today. Thank you for taking the time to join us. My name is Sarah, and these are my colleagues, Melina, Terry, Celia, Olivia, and Justine. We are nursing students at McGill University. We are here to share general information for learning purpose only. This workshop is not a medical advice. If you have personal health questions or concerns, please speak with your doctor or healthcare professional. Thank you for your understanding. Before we begin, we just want to reassure you that our goal is to keep things simple and clear. You can ask questions at any time. Simply type in chat or raise hands. Terry will monitor the chat for questions. There are no bad questions. If we are ready, let's begin. First, we are going to talk about understanding arthritis. What is arthritis and common myths about arthritis? Then we are going to talk about the importance of physical activity, type of exercise that support health joint, arthritis-friendly activities, safe exercise type, guided movement demonstration, and we will end with non-pharmacological pain strategies. Now my colleague Celia will talk about understanding arthritis.
Thanks, Sarah. Hi, everyone. I'll be covering the first part of this session where I will be talking about what is arthritis in general, and I'll explore some common myths and realities surrounding it. So arthritis is a medical term that is used to describe swelling in a joint. However, it's often also used to describe all types of joint pain. So in the next slide, I'm going to present some statements about arthritis. I'd like you to think about whether you believe it is a myth or a reality. Feel free to type it in the chat or just raise your hand if you want to share your thoughts out loud. So myth or truth, number 1, arthritis is just a wear and tear. Okay, we got some answers already. I'll give like a minute or so other people participate. We got some hearts. We got different answers. So we have a myth, false, myth, myth. Few seconds if somebody else wants to type in the chat. All right, so we can go to the next slide. And it's actually both. So great answer to everyone. It's a myth and it's also a truth. So there are two types of arthritis. We have osteoarthritis, which is caused by joint wear. Osteoarthritis occurs when the parts inside the joint, like cartilage, starts wearing out over time with heavy use. This can make the joints feel stiff, cause pain, might be harder to move. It's kind of like when the wheels on a bike get worn down and don't roll as smoothly anymore. But we also have another type of arthritis, which is caused by inflammation of the joints. It's not just wear and tear. The inflammation might be due because an infection in a joint, like somehow a bacteria gain access to a joint and cause infection, the joint swells up and causes a lot of pain. Or there is another condition that is called rheumatoid arthritis, where the immune system mistakenly attacks the joints and destroy the cartilage, and that causes swelling and causes as well some pain. So this is why it's both. We're gonna move on to the next slide. Perfect. Myth or truth number 2. If you have arthritis, the only symptom you will notice is pain. I'll give you some, like a minute or so you can type your answers. All right, so we can go to the next slide with the answer. Perfect. So this is a myth. Some people feel stiff in their joint in the morning or after sitting down for a while. Joints can also look bigger because there is extra bone formation around them. This can happen in small joints like your fingers, or big ones like knees. It can also be harder to move the joint fully because of changes and swelling. This usually happens with osteoarthritis. However, in the other type of arthritis, the rheumatoid arthritis, the main problem is true that it happens around the joints and the swelling. But also rheumatoid arthritis, can affect other parts of the body like skin, eyes, lungs, heart, kidneys, blood vessels, and nerves, because it's a systemic condition where the immune system attacks other organs, not just the joint. These symptoms are experienced by 40 out of 100 people with rheumatoid arthritis. So we can go to myth and reality number 3. Perfect. Being overweight does not cause joint pain or damage. I'll give you a minute so you can type your answers. All right, so we can move on to the next slide. So this is also a myth. Being overweight does affect your joints. The extra weight puts more pressure on joints like the knees or hips, which can cause more wear and tear, pain, and damage over time. It can also make the joint pain worse. Some studies have shown that losing weight can make joint pain go down a lot. This might be because lighter weight puts less pressure on the joints, but even joints that do not hold weight, like the ones in your hands, can also, the pain decreases a lot after the individual loses the extra weight. So we can move on to the next slide. Perfect. Moving your joints make joint pain worse. Is this a myth or a truth? and we can reveal the answer. This is also a myth. So joint movement can make pain feel worse at first, but several studies show that exercise is very important to help reduce pain over time. Now, the type of exercise and how much you do matters, and we will talk about the type of exercises in a moment. And our last myth or reality for today.
Thank you, Celia. Hi, everybody. I'm just one.
Yeah, just 1 second. There was a question in the chat. Someone asked, how is arthritis diagnosed?
Yes, it can be diagnosed with laboratory tests, imaging tests like X-rays or MRIs, with physical exam and with a review of your medical history.
Thank you. Sorry, go ahead, Melina.
Thank you, Maria. Before we look at specific exercises, it's important to understand why moving your body is so important when you have arthritis. Physical activities help ease pain and makes it easier to move. Your joint really needs to move to stay healthy. Inside your joint, there's something called cartilage. It acts like a protective cushion in your joints. You can think of the cartilage like a sponge. If a sponge just sits there and doesn't move, it becomes dry and stiff. If you squeeze the sponge around fluid, it will absorb it. In your joints, you have fluid. So when you move, the sponge is squeezed and absorbs the nutrient from the fluid around your joints. The fluid helps keep the cartilage healthy and prevents damage. So being active helps feed and protect your joints. On the other end, when you don't move enough, your joint can become stiff, your muscle can become weaker, your pain can increase, your risk of fall can increase, and your independence can decrease. It's also important that there are different types of pain. Some people have more mechanical pain, some have more inflammatory pain. Inflammatory pain is often worse in the morning and tends to get better during the day. So maybe if people have inflammatory pain, the early workouts are not the best option for those people. But mechanical pain happens when you repeat the same movement many times. Example, kayaking on a long distance. This activity might not be the best option for you if you have arthritis in your shoulders because it uses the same motion over and over. So before choosing an activity, try to understand your type of pain. You can also ask your healthcare professional, such as a doctor, physiotherapist, or a kinesiologist to help you. Choose an activity that's suitable for you. Remember that everyone is different. There is no one size fit all plan. We all have different bodies, different type of arthritis, different health histories, different limits, and so on. Now let's go over exercises that support healthy joints. A good program should include different type of movement. Flexibility exercises reduce stiffness and help your joints move more easily. They are great in the morning or after sitting for a long time, like Celia said earlier. They are easier to do after a hot shower because your muscles are more relaxed. Muscle building exercises help build the muscle around your joint. Strong muscle protects your joint and help reduce pain on daily activities. Examples include working out with weight, resistance band, doing Pilates, or since the summer is almost there, heavy gardening with digging or shoveling could be good too. Heart healthy exercises include walking, swimming, cycling, aquafitness, and more. These exercises help improve your energy and keep your heart strong. They can also make everyday activities easier, like climbing stairs or carrying your groceries. Relaxation exercises like yoga or Tai Chi help improve balance, flexibility, reduce stress, and they can also reduce pain. Some activities are better for arthritis because they are low impact, meaning that they are gentle on your joint. When choosing an activity, pick something that works for you and know your limit. Walking is a good example of a gentle activity. And yes, if you need a walker or a cane, it's perfect to take your device to take your walk. The device allows you to move and improve your safety. So when picking an activity, try to remember the acronym FAST. The activity that you pick should be fun, because if you pick something that you like, you are more likely to keep doing it over time. It should be accessible, meaning it fits your space, your budget, your ability. Think about the equipment. Do you need it? Can you have access to it? It should include a structure or routine, like doing yoga at the same time every day, or walking with a friend and her dog every day, every Tuesday. You can also plan the distance you want to swim or you want to walk, or the route you're going to take on the bike path that day. Timing also matters because, for example, some people feel better moving after taking their medication or later during the day when the stiffness improves. And remember, you are doing the activity for you and your health, not to please your partner or family or your healthcare professional. Before I finish, I just want to go over a few important safety tips. When you start being active, try to go slowly. There is no rush. Let your body get used to the movement little by little. Try to move in a way that feels comfortable for you, and most importantly, listen to your body. You know your body best. If something doesn't feel right, it's okay to adjust or change the exercises. Pain is also your body's way of talking to you. A little bit of discomfort, especially at the beginning, can be normal. But if you feel a sharp pain or pain that lasts, it's a sign to stop and make a change. And because we are nurses and we love grading pain from a scale on 0 to 10, I'll provide you an example. Remember, on that scale, 0 is no pain at all, and 10 would be the biggest pain you ever felt, like you would say to your friend, take me to the emergency room right now, I'm feeling like I'm burning alive. During an activity or exercises, if your pain is between 0 and 3, it's usually okay to keep going. If it's around 4 or 5, maybe slow down, do less, take a break. If your pain reaches 6 or higher, it's best to stop, modify what you're doing, or stop the activity altogether. You can also apply ice to relieve pain, but we'll get to it later in the presentation. When your pain gets worse than usual, you don't need to stop moving completely. If one day you wake up and your pain is like worse than the day before, stay active, do a little less, go slower, take more breaks, choose something easier that day maybe. The goal is to keep moving in a way that feels okay for you. The most important thing to remember is that doing a little bit often is better than doing too much all at once. Even 10 minutes here and there during the day can really help over time. So the goal is not to do more, but to move better. Do we have any question? I see one in the chat. Warming up is more important than stretching before doing an exercise, so your muscle is more warm. And stretching would be after, then your muscle would be already hot, so you can reach the stretch better. Collagen. I'm not sure about how good is collagen, but we're not gonna talk about medication because medication can be very specific for a person in the past history, so we're not gonna talk about it.
A good person that you could contact that's easier than a family doctor possibly is even just calling your pharmacy. They know your meds, they see your file, and they can let you know if collagen is a good option for you or not.
Juste un petit peu changer. Okay. Simple exercise. We're gonna Justine film a little exercise at her place. So we're gonna show you the exercises. They are simple. They are made for people with arthritis. You can do those at home. You can adjust them to your level. And if you have a program training, you should try to increase the difficulty every 6 to 8 weeks if possible. I'll let you with the video.
So just quickly, as Melina said, we are nurses before, so I am not a personal trainer. I did my best to try to film it and make sure that they were all safe. I did a variety of different stretches, strengthening exercises, and you can find more on arthritis.ca as well.
There's no volume, ladies.
Okay, I can hear it on my computer. Let me see if I um We hope you're enjoying the workshop so far.
Do we hear it?
We're now moving on to the exercise
Yes.
demonstration portion.
Yes, it's good.
Okay. We hope you're enjoying the workshop so far. We are now moving on to the exercise demonstration portion, where we'll be showing a variety of exercises focusing on different parts of the body to help with strengthening and stretching. It is up to you if you choose to follow along throughout the session or if you'd rather just sit back, watch, and see what you would like to try in the future at home. If you have any questions regarding the exercises, feel free to ask at the end of the session during the question period. So let's get started. This exercise will focus on strengthening our calf muscles. I begin with a surface where I can place my hands for support and to help me with my balance. In this case, I chose a chair, but we could also use the countertop or a table. I begin about 2 feet away from either the counter or in this case the chair, and I place my feet hip width apart. I then hold on to my support or graze, depending on how we feel about our balance, and I will stand up on the balls of my feet, leaving the heels off the ground as high as I can, and I'll hold it for 3 seconds. 1, 2, 3, and I go back down in a controlled manner. And I go up, 1, 2, 3, and I go down. And I go up, and I try to make sure that my feet don't roll in, and I hold it for 3 seconds, and I go back down. If we really struggle with balance, we can also adapt our calf raises to do them seated down. In this case, I will move forward in the chair, and I'll make sure I have a good posture, so shoulders back, open, chest forward, and I put my hands on my thighs, feet hip width apart again, and we'll raise onto our toes again and hold it for 3 seconds. So 1, 2, 3, and we'll bring back down. We'll go back up and hold 1, 2, 3, and bring back down. What's nice about doing them seated as well is that we can incorporate them easier throughout the day. So we don't necessarily need to be standing up and make it a task, but rather just simply while we're sitting down, incorporate this easily. This exercise will focus on stretching our hamstrings. We need a surface to support us, whether it be a chair, a countertop, or a table, or in this case, I will be using the door. I stand in front of my support surface, and I have about a step away, and I place my hands, and my feet are hip width apart. I then will be bending my knee so that my heel is going backwards, like this. And I make sure that I stay aligned. My leg is straight with my pelvis and my core is engaged. And my toes are pointing down to the ground, and I hold it and I bring back down in a controlled movement. So I will do it again. Go up, toes down, straight, and back down. And I can do that about 10 times or as many times as it feels right. And then I will repeat and I will do it on the other side as well. So back, align with the other leg, toes down, and I bring back. And I go up, and I hold, and I bring back down. Always thinking back, controlled movements. We will now focus on the quadriceps. We can use a staircase, and we just use the bottom step, making sure that we have support on both sides. We start by stepping with the right foot and putting our weight in this leg to push the left foot up. And we hold for a few seconds. 1, 2, 3. And we go back down in a controlled movement. And we repeat. 1, 2, 3. And we go down in a controlled movement. And we push back into the right leg. 1, 2, 3. And we go back down. And we repeat on the other side. Again, we do as many repetitions as feels comfortable for us. And now we will do the left leg. So we put our weight on the left side and we push up. And we make sure that we don't go too forward above our toes like this. And we hold a straight leg. And we go back. And we bend, keeping our core engaged. And we go up and we hold 1, 2, 3. And we go back down. And we go up. 1, 2, 3. And we go back down. If some of the exercises standing up are slightly too difficult, we can also adapt them by sitting down, such as bending our knees. So we can even use our hands to help us bend it higher. And hold it. And we repeat this. And these stretches feel so good afterwards as well. So we can do 20 times total, 10 stretches on each side. It's very important to not undermine the small exercises that we can do throughout the day. Here are a few. First, you can start by stretching our legs out on the chair and just moving our ankles side to side, like this, about 20 times. Next, similarly, what we can do is do our toes pointing up and down, up and down. And we can hold these positions a bit through, so holding it stretched, and bringing it back, holding it a bit, and stretch, and back. This seems like a silly exercise to be doing, but posture is so important. We start off with a steady surface behind us. In this case, it's going to be these closet doors, but a wall. And we stand back, our body touching the surface. Whatever touches, touches, okay? We don't have to focus too much on positioning as much as other exercises. And we stand there with our palms open, facing out, and we touch our shoulder blades and we try to bring them back, and we open our chest, and we take a big deep breath in. And we exhale. And each time we take a breath, we try to make ourselves taller and taller. And another one. And we do this as many times as we want. And we leave the wall and we try to remember to think about staying as tall as possible. And we try to focus on our posture for the rest of the day as well. To help with back pain, it's very important to have a strong core. So we're going to start off. We're going to lie back down. And this can be on a bed, on a yoga mat, any kind of mat. And we bend our knees, feet about hip width apart, and our hands, we put them on our abdomen about fingers reaching towards our belly button. And we just raise our foot slightly for a breath. We hold it there and we put it back down. So just raising like this. And we should feel the muscles under our hands working. And we make sure we engage the core, and we shouldn't feel this in our lower back. So we hold it a bit and we put it back down. We can go to the other side. Lift up a bit. We feel the muscles. Hold it. Put it back down. Hold it. And put it back down. Again, we'll repeat. And back down. So we can do this a few times, making sure that we do it an equal amount on both sides. For this exercise, again, we start on a surface where we can lay down, a yoga mat, bed, any kind of mat. And we're gonna bend our knees about 45 degrees and hip width apart, our feet. And we raise our hips towards the ceiling. So our pelvis goes towards the ceiling as high as we can, making sure that while doing this, our shoulders and our head stay touching the ground. And we hold it for a bit, and we can go back down slowly. And we go towards the ceiling. And we go back down. And we can do this as many times as we'd like as well. And if we feel it a bit too much, we can raise a little less. So even if it's just slightly off the ground, just ensuring that the shoulder blades and the head always stay on the ground. And very important that our knees don't cave inwards. So we keep our knees nice and straight, aligned with the thighs. And again, this exercise, very important to breathe through it. If we have too much pain in our shoulders, our neck, or our upper back area to do our core exercises while lying down, there are certain options that we can do standing up. Here is one of them. We start about foot width apart from the wall, and we turn to be parallel. We put our right arm against the wall, and we lean our hip in below the arm. And we push our hip out using our core muscles so that it aligns with our shoulder, hip, and ankle. And we go back in. And align using our core muscles. We feel it in our upper muscles of the abdomen. And we repeat for the same amount of reps on the other side. So similar setup, but we're leaning on our left side. Leaning our hip in. Making sure everything's straight. And go out. Align. Go back. And important with this exercise is to imagine ourselves between two glass walls. So we want to make sure we're not leaning too forward, too back, and we're staying in those two glass walls. This sequence of exercises is to help us with our shoulders. It's a little series of 3 exercises all put together, which we repeat 20 times or as many times as tolerated. We start off by putting our elbows and our hands, the palms together in front of us, and we open them at the same time to put our hands next to our body like this, parallel with our chest. And we raise up and we stretch and we try to touch the sky, but without bringing our shoulders too much to our ears. And we bring back down and we do the same thing. So we start again, palms and elbows together, open up, feel our shoulder blades trying to meet, and we rise up. And we come back down, starting to the starting position, and start again. So this can be repeated 20 times or as tolerated. For the shoulders again, we can do this exercise where we start with our hands out in front of us, palms touching, fingertips touching. Keep nice and parallel with the shoulder. And we bring our hands back, squeezing towards our chest, and we feel our shoulder blades trying to meet in the middle. So we start off like this and we come back. It's like we're swimming a bit, but not quite. Bring it back and go forward. Back and go forward. And we feel those shoulder blades trying to come back in the middle and touch. 20 times or as tolerated. The last part of this exercise demonstration video is going to cover some exercises for our hands. We can't forget about them when it comes to arthritis. And the first exercise is we're going to be squeezing this face cloth in this case, but they make stress balls purposely for this as well. And so we place it in the palm of our hand and we wrap our fingers around it and we squeeze for 5 seconds. 1, 2, 3, 4, 5, and as hard as we can, and we release. And we can do it again. 1, 2, 3, 4, 5, and we release. I could have also taken a second face cloth and done both sides at the same time, but if not, we can just alternate as well. So 1, 2, 3, 4, 5, and release. And we can go back and forth as well, and we repeat this as many times as we'd like. If you're having an active flare-up, this is not recommended though. Now, similarly, what we can do is we can clench or make a fist, but we're not clenching it like we did last time. So we're not squeezing as hard as we can. We're just holding it like this for a few seconds. 1, 2, 3. And we open and we stretch our fingers as much as we can, like we're reaching for the sky. So we do it again. Our thumb is outside like this. 1, 2, 3, and we open and we stretch for a few seconds, and we can repeat. Next, we can put our hands on the flat surface, put our thumbs, and then what we do is that we bring our fingers outwards. So our index finger will go out, we'll move our middle finger, we'll move our ring finger towards our pinky, and it's quite challenging. And then we can re-stretch them out, bring the pinky in, bring the ring finger, middle finger towards the index, and spread out, and repeat that a few times as well. We know that this list of exercises is definitely not exhaustive, and there's plenty more out there. But we hope that it gave you an idea that you can still move even if you have arthritis, and sometimes you just have to adapt. Most of these exercises come from arthritis.ca, where they have plenty of different options for you. And we highly recommend that you check it out for your next exercises. And that if just this little bit made you realize that you can move, that's all we wanted. Also, not mentioned, but just last but not least, walking. Walking is so good for you, and it's underestimated. So low impact cardio, add some walking into that exercise routine as well. So I hope you guys enjoyed watching this pre-recorded video and that some of these exercises will stick with you. I didn't include any of the exercises that used resistance bands, but if that is in your price range or they are available to you, they can be adapted for some of them, or even with small weights, such as like the stretching with the shoulders. We could use little 1 pound dumbbells if we want. And it's all about working up. So we don't necessarily start there, but it progressively we can increase. Or if we do, 5 exercises that day, we did 5 repetitions. Well, maybe the next day we'll try to do 7 repetitions. So it's all about progressing slowly. I just want to be sure was there a question in the chat? Because I don't have it open on my screen.
We're good.
Okay.
That was really well done, Justin. Very
Thank you.
nice.
Thank you.
And I noticed that I saw a participant that was actually doing the exercises at the same time as me.
Amazing.
So I'll be talking about ways you can reduce pain without using medication. So as always, before you start anything new, we just encourage you to speak with your doctor or healthcare practitioner to make sure it's appropriate for you. So as we previously mentioned, exercise is one of the best ways for pain management, including aerobic activities. So I won't go into it again as we already covered it quite thoroughly. But one of the important things to remember is that you would want to have proper footwear for your exercises, because this can prevent injuries and falls. So proper footwear includes making sure your shoes aren't too tight or too big, having supportive footwear opposed to a flat sole. And there's even some places like the running room that you can go to that can have help you find that specialized footwear that would help benefit you the best according to what exercises you'd like to do. Another way that exercises can help is by doing group activities. So there is a study that showed that people with arthritis or chronic pain can deal a lot with loneliness or mental health issues like depression. So having group exercises can really benefit the individual by one, motivating each other, and two, just having that socialization aspect and being able to do it with a group. It's also important just to make sure your body mechanics are good and that you aren't pushing yourself. So another way that can have a good positive impact on arthritis is massage therapy. It does have the benefit of alleviating pain, and it also has the benefit of helping you with your mental stress. So if it is appropriate for you to go to a masseuse, for example, or to do massage therapy, it can really benefit you with stress, with tension, and alleviate a bit of that pain. Another great intervention is the hot cold therapy. So, as Melina was saying, sometimes you might wake up and you're feeling very stiff and your joints can be very sore. So, having either an ice pack or a heat pack can help reduce inflammation, relax your muscles, and provide pain relief. It's important, though, that you do not apply the heat or the ice directly to your skin. So, you want to wrap it in a towel and then place it on your affected area or joint, and to do it no longer than 15 minutes at a time to avoid any burns or skin breakdown. Also, when you are warming up a heat pack, it is important to follow the instructions. Most of them will tell you not to warm them up at 30-second intervals for no more than 2 minutes. Another way that you can help manage your pain is by protecting your joints. So this is using your assisted devices if you have them, making sure that they are the proper height for you, to stabilize your joints by using good posture, engaging larger muscles, so not bending at the back, but instead using your larger leg muscles. getting out of bed slowly, ensuring that your devices are close by. If you have a grabber, so you don't have to bend down to pick things up. If you don't, then maybe try squatting. Avoid carrying heavy bags. And if you do have to carry heavy bags, you would want to focus on distributing your weight across your larger joints instead of just kind of grabbing it willy-nilly. And finally, another great way is nutrition and hydration. So I know this has been spoken about so many times, but it is true that nutrition can really help you with getting enough vitamins and nutrition, and protein especially is very good. And as well as making sure that you are drinking enough water, which can help lubricate your joints. It could be good to consult with a dietitian or a nutritionist to take a look at your eating habits to see if there's any gaps, and if appropriate, discussing weight management, as we spoke about, this could impact your joints, and just ensuring you're having like vitamin C, calcium-rich foods, and again with the protein.
So unfortunately, we are already nearing the end of the presentation. So to wrap things up, let's quickly review the main points we've covered today. We learned that arthritis is a general term for joint swelling and pain, and it isn't always just wear and tear. It can be the wear down over time, like osteoarthritis, or inflammatory when there is irritation inside the joint or when the body attacking itself. We can remember that symptoms often include morning stiffness, swelling, for example, and not just physical pain. We also discuss how maintaining a healthy weight reduce pressure on your joints, including the tiny joints like those in your hand, which can significantly decrease your pain. After, we can switch the slide. The most important takeaway of this presentation is that the movement is essential because, like my colleague said, cartilage is like a sponge. Cartilage needs activity to absorb nutrients and stay healthy. While it may feel uncomfortable at first, consistent and easy-friendly exercise like walking, swimming helps reduce pain over time. But you always have to listen to your body. So move at a pace that feels comfortable for you. And when the pain is worse, you don't necessarily have to stop. Instead, modify your activity by reducing repetition or just switching to gentler movements. Finally, don't forget, we can switch the slide. Don't forget that heat or cold application, it's not more than 15 minutes. Proper hydration and massage therapy can also provide significant relief. In conclusion, managing joint pain is not a one-size-fits-all approach. It's about consistency over intensity and finding activities that are fun, accessible, and that fit into your lifestyle. As I remember, we are nursing students at McGill University, and the information shared today is for educational purposes only and does not constitute medical advice. If you have specific concerns about your health, please consult your doctor or a healthcare professional. Thank you all so much for your time, your participation, your great questions, and we hope you feel more confident in managing your joint health and confident in moving. So, are there any final questions before we head out? Thank you.
One of the questions from our participants is if you have these exercises on paper form, and if you can forward them to me, and I will forward them to our guests of today. I'm not sure if you have them on paper.
Yes, we will send the paper to Maria and take Maria.
Yes,
can.
I will forward, yeah.
Okay.
Yeah.
But I think I might have it already. I have it already. So I'll send it to
Yes.
you, Silvana, for you to share with all our participants today.
Okay. So before we continue with the questions, I just want to say thank you very, very much. This has been very interesting. I'm going to stop the recording and we can start the questions.